Good afternoon. Oh, it's already become good afternoon. Just good afternoon, no? 12 o'clock, you're seeing time and... Come.
Came from my group.
Yeah. So you've already had a couple of nose jobs, right? So what is it that you want now?
So this is looking like a little fun.
Okay,
So anything can be improved in this.
on the nose. Okay. So you already had two procedures.
Actually, I am going for DNS first.
Okay.
And that time I was not knowing about rhinoplasty.
So they did a septoplasty for you already.
Septo plus rhinoplasty, first time they did it.
Okay.
And that time she said, okay, if you done rhinoplasty, again you look better. Girls means of course that will be the... I said, okay, you do it. First time they did that two surgeries, septo plus rhinoplasty. And second time I got infected sinus after surgery. They said, okay, we'll do that test procedure. With that, it was looking little here down this side. Pinched nose like that it was looking. So with that again she did this. They took cartilage from here, and they placed here. I thought it was not necessary, but I was not knowing. I am not doctor how they will do. So after surgery this is looking little odd.
Okay.
Inside only little.
Yeah, I know, I can see a scar. Yeah, I can feel that. Okay, I think we should be able to improve. Yeah, this glass has not a very... Okay, so see, the first thing that we can do is to improve the tip because it's a little bit twisted. The next thing we can do is we can reduce a little bit, and the other thing is, I'll show you the mirror. Come here. So what's happening is, if you see on the side, look on the side. This is the angle. Look here in the mirror. You have to look in the mirror. This angle is like this, okay?
Left side, no?
Yeah, look there. So you got to bring it like this.
Tip we have to reduce it.
Like this, see? Then it'll look nicer. This one should go in and this one should come down. It should be like this, much more defined, sharper tip, you know. That's the main thing.
What will do for this, sir?
I'll remove that.
Better, I think so.
It's still bulbous, right? And here also we can reduce it. And there's a small hump.
No,
width.
because of this one, it is looking here hump. If you
Correct.
remove this one, it looks straight.
It'll be almost straight. Yeah. But we'll have to remove it and also put another one.
Again, cartilage.
Mostly.
I'm actually, so I don't want to put again cartilage here. Without cartilage, we can't do it.
See, without cartilage, sometimes what happens, it can collapse. They have already done two procedures and they have used the cartilage to support. But the cartilage is not sitting in the right place. It's become a little bit bulbous.
This cartilage again, we can't use it.
Difficult. Because see, what happens is, remember, just imagine like this. You are building a wall. So when you're building the wall, you need brick and then you need plaster and then you put everything and you set it. Now what happens? The wall is not straight. It's a little bit bent like this. So it's very hard to break that and do again. What people do, you break it, again put bricks and come up. This is something like that. Not exactly. Because what happens is the cartilage, they would have cut it to fix that particular thing that they thought was needed. But it's not precise. So I cannot usually use it. Very rarely we are able to use. In your case, because already two procedures have been done, so usually will not be able to use. That's what we have to assume. If we are able to use, well and good. But because it's a couple of revision rhinoplasties happening, so we should be prepared. See, I don't harvest usually from the ear. I prefer the rib because you have much more solid quantity of rib available, and already there's a scar that's visible here. And the rib scar is not going to be visible for anybody, including you, because it's an inframammary incision, it's a tiny incision and all of that. You will need to give us consent. In case needed, we will harvest. In case we are able to manage, we will do it with this itself. It's not compulsorily needed, but maybe it is needed.
During second surgery, they said we will take from here only. Already cartilage is there.
They took it from there and put it.
During surgery, I was not knowing the anesthesia. But they took from here.
That happens. That's why we say take permission first only and say plus or minus rib. Some patients 100% I know I'll need rib. Some patients I'll know 100% I'll not need rib. But some patients we are not sure till, especially revision cases, you know.
Because what I am expecting, doctor, I don't want major surgery. Just I wanted in minor.
It's not major. I mean, it's
harvesting is major only.
no, not like that. In fact, the major will be the work on the nose, not on the rib.
Okay. Shall I show you my after second surgery photo without this cartilage?
You can just show it to me. Take rib.
I already sent to your hospital.
Yeah, I would have seen it, but just show me once more now.
Without cartilage, it was like this.
But at that time, I think there was some asymmetry. This was big, this was small, and all that.
That's what it is. This one. This is the before surgery nose. It was a little broad. So here
Correct.
they improved. They put cartilage here.
Yeah.
And this one she did it straight, and she lifted. She didn't told me that lift your nose. I thought they did all experimental on me. Seriously?
No, it's not looking like bad. See, what happens, right? They have done improvements. They have done little improvement there, they have done improvement.
After that, after this I am upset, doctor, actually. This one.
You are little upset, but Ashtu, it's not bad. Improvement is there. From that, there is improvement. They have not made it bad. Kannada ಗೊತ್ತಿದೆಲ್ಲ ಆಮೇಲೆ
ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಓದಿದಲ್ವ ಇವರು?
ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಓದಿದ್ದೆವು, ಮ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಇದ್ದೀನಿ ಸುಮಾರು ವರ್ಷ. ಈಗ ಅಷ್ಟು ಪ್ರಾಕ್ಟೀಸ್ ಇಲ್ಲ ಇಲ್ಲಿ ಒಂದೊಂಥರ.
ಸ್ವಲ್ಪ ಅಭ್ಯಾಸ ಹೋಗಿದೆ.
ಅಭ್ಯಾಸ ಹೋಗಿದೆ, ಕರೆಕ್ಟ್. ಬಟ್ ಮೋರ್ ದೆನ್ 20 years I was in Karnataka.
ಅದೇ ಗೊತ್ತಾಯ್ತು, ನೋಡಿದ್ದೀನಿ ನಿಮ್ದೆಲ್ಲ ಗೂಗಲಲ್ಲಿ ನೋಡಿ. ಈಸ್ ದ ಬೆಸ್ಟ್ ಡಾಕ್ಟರ್, ಬೆಟರ್ ಐ ಕನ್ಸಲ್ಟ್ ಇನ್ ಒನ್ಸ್.
ನೋಡಿ, ನಿಮಗೆ 100% ಸರ್ಜರಿ ಬೇಕಾಗೂ ನಾನು ಹೇಳೋದಿಲ್ಲ. ಬಿಕಾಸ್ ಯು ಆಲ್ರೆಡಿ ಬ್ಯೂಟಿಫುಲ್. ಆ್ಯಂಡ್ ಅವ್ರು ಮಾಡಿದ ನಂತರ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇದೆ. ನಾನು ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇಲ್ಲ ಫೋಟೋ ನೋಡುವಾಗ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇದೆ. ನಿಮಗೆ ಇನ್ನೂ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಬೇಕಾದರೆ ಮಾಡ್ಬೋದು. ಬಟ್ ಡಿಪ್ರೆಸ್ ಆಗಲಿಕ್ಕೆ ದೇರ್ ಇಸ್ ನೋ ರೀಸನ್.
ಇಲ್ಲ, ಆ ಥರ ಇಲ್ಲ. ಆಕ್ಚುಲಿ ಓನ್ಲಿ
ಬಲ್ಜ್ ಇಸ್ ದೇರ್. ಅದು ಕರೆಕ್ಟ್. ಕರೆಕ್ಟ್.
ಬೇಜಾರಿಲ್ಲ.
ಅದು ಬಲ್ಜ್ ಇದೆ, ಇಲ್ಲ ನಾನು ಹೇಳೋದಿಲ್ಲ. ಬಟ್ ಅವ್ರು ಏನಾಗಿದೆ ಅಲ್ಲ, ದಟ್ ನೋಸ್ ಇಸ್ ಫ್ಲ್ಯಾಟ್. ಅವಾಗ ಅವರು ಇಂಪ್ರೂವ್ ಮಾಡಲಿಕ್ಕೆ ಅದು ಸ್ವಲ್ಪ ಆಗಿದೆ. ಬಟ್ ಇಟ್ಸ್ ಓಕೆ. ನೀವು ಬೇಕಾದರೆ ನಾನು ರೆಡಿ ಮಾಡಿ ಕೊಡ್ತೀನಿ. ಇಟ್ಸ್ ನಾಟ್ ಲೈಕ್ ಮೈನರ್ ಸರ್ಜರಿ ಹೇಳಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಬಿಕಾಸ್ ರಿವಿಷನ್ ರೈನೋಪ್ಲಾಸ್ಟಿ ಆಗುವಾಗ ಅದು ಮೇಜರ್ ಆಗ್ತದೆ. ಬಿಕಾಸ್ ಇಲ್ಲ ಅದೆಲ್ಲ ಕರೆಕ್ಟಾಗಿ ಬರ್ತದೆ. ಬಟ್ ಸಮ್ ಟೈಮ್ ಆಗ್ತದೆ. ಇಟ್ ವಿಲ್ ಟೇಕ್ ಟೈಮ್. ನಿಮಗೆ ಇಲ್ಲಿ 1 ವಾರ 5 ದಿವಸ ಇರಬೇಕು ಆಗ್ತದೆ. 1 or 2 days ಆಗೋದಿಲ್ಲ. ಅದು ಐ ಕ್ಯಾನ್ ಡಿಸ್ಚಾರ್ಜ್ ಯು. ಆಮೇಲೆ ದೆನ್ ಅಗೇನ್ ಯು ಕ್ಯಾನ್ ಕಮ್ ಬ್ಯಾಕ್ ಆರ್ ವಿಲ್ ಗೆಟ್ ಇಟ್ ಡನ್ ಇನ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಸಮ್ ಫಾಲೋ ಅಪ್ ಇನ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಮಾಡಿಸ್ಬೇಕು. ಸಾರಿ, ನಾನು ಬರೋದಿಲ್ಲ. ಐ ವಿಲ್ ರೆಫರ್ ಯು ಟು ಸಮ್ ಡಾಕ್ಟರ್ ಐ ನೋ. I have some people in Bangalore.
He is upset with the Bangalorean doctor. That's why.
ಅವತ್ತು ನಾನು ಹೇಳ್ತೀನಿ ನೋಡಿ ನೀವು
Your doctor is already consulted. Please.
Oh, don't cry, sweetheart.
Wait 2 minutes.
No, take her. No problem. What is it?